So if you or someone you know, let's start again. If you or someone you care about lives with chronic fatigue syndrome, also known as MECFS, and we'll get into that distinction in a moment, you know how it deeply affects every aspect of life: your body, your mind, your energy, your ability to function. So in this live video, we're going to explore honestly and compassionately what treatments are out there, both medical and mind-body approaches. I'll walk you what's currently recommended, what's not recommended, what the research says, and what many people are exploring on their own. So we'll cover everything from medication that might help with pain, sleep, orthostatic intolerance, to experimental therapies like low dose naltrexone, Amplogin, and why some treatments are now considered outdated or even harmful. And we'll also dive into the mind-body side of things. Things like nervous system regulation, mindfulness, and vagus nerve support. I often see posts from people saying, oh, that's woo-woo mind-body stuff. Actually, ignoring the science on the mind-body connection is woo-woo. It's unscientific to do that, okay? So these approaches are often overlooked, but they can make the world of difference. I've worked with people who say that learning these mind-body techniques have been transformative. And I've got about 4 emails in the last week from people sharing the massive changes that they've achieved. And I'll talk a bit more about that in the video I release next week. So I do talk about the whole topic of pacing, and in another video. Is pacing helpful for MECFS and long COVID? So do check out that video on my YouTube channel. So whether you're newly diagnosed or have been dealing with MECFS for years, this is a space where we can share, learn, and reconnect with our bodies in a more compassionate way. So if you are here watching me live, do feel free to say hello in the chat. Good to see people have joined me. It's always nice to have company. So yeah, feel free to say hi in the chat. Let me know where you are in the world. And it'd be also interesting to know how long you've had these conditions. Okay, so just let me know in the chat if you wish. Okay, so, and it'd be good to know that the chat is working. Let me just put a hello in the chat just so I know it is coming through. All right, so key thing here is there's no one size fits all treatment, but there are ways in which we can support our bodies, and we know that by getting our body in a more regulated state can really help the body's healing, and I'll talk more about that in a bit as well. All right, so if you don't know me, my name is Simon Pimenta. I had ME/CFS fibromyalgia for 8-9 years. I went from not being able to walk 1 minute at times and sleeping and resting 18 hours a day to going back to work, living my life and loving life. Today, at the moment, this week, I keep waking up quite early, so I've been getting up, got lots to do. So I was at my desk at 6:30 this morning. All right. So there was a time where I couldn't even look at a computer for 5-10 minutes. So Harmony says, hello, chat is working. Thanks for letting me know. So what really helped me was mind-body approaches, not medication. It wasn't something that I didn't go down that route because my body was so sensitive. I just came to the conclusion that, you know, my body wouldn't tolerate some medications, and I did have medication for anxiety when I was younger. Didn't really help, but it did make me feel really dopey. All right. So, but I'm not against that. You know, you have to use your own judgment. So what helped me was those mind, body, and practical approaches. And so now I create lots of free content to help you move towards your goals. I wish I had the information that I share on my YouTube channel when I first got sick. Margaret says hi from Victoria, BC, diagnosed 2021. Okay, so what was that with MECFS, or was that long COVID, Margaret? Let me know if you wish. No obligation. So if you do like my videos, do leave a comment, do subscribe, hit the notification button. You'll be notified when I release new content. And do share the videos. That'd be really super. Helps people find my channel. Okay, so let's get into it. First of all, what is ME/CFS? So, as I say, these terms ME/CFS and CFS are used interchangeably. The Nightingale Foundation, under Dr. Byron Hyde, proposed that myalgic encephalomyelitis can be objectively identified via specific brain imaging techniques. And according to their criteria, if the person doesn't exhibit measurable abnormalities shown by this SPECT scan, then the patient does not have ME. Now the question is, how many people have had a SPECT scan? I don't know anyone who's had a SPECT scan. If you do, if you've had one, let me know. In the UK, it's not something that's offered. So Dip, hi from Florida. I'm having trouble with the volume. Okay, if anyone else is having trouble with the volume, let me know. I want to check if it's my end or whether it's your end. So just do let me know. Margaret, ME/CFS, some doctors originally said long COVID. Okay, sorry to hear that. So CFS, a general definition, is a complex chronic illness that affects energy production, the immune system, the nervous system, and often cardiovascular and digestive systems as well. Key symptoms include unrelenting fatigue that's not relieved by rest, cognitive issues known as brain fog, sleep problems, muscle and joint pain, orthostatic intolerance, so dizziness and rapid heart rate when standing, and most importantly, post-exertional malaise, where symptoms worsen after mild activity. Now, I have made a video about post-exertional malaise, made a couple of videos, so do check those out, because I question whether the malaise is just to do with the exertion. Okay, so watch that video, that will make more sense. Okay, but there's the presumption in that term, post-exertional malaise, that it's a result of the exertion. So yes, the volume is low. Okay, let's just not my. Let me see if I can turn that up a bit. I don't know why. Sorry, but is it really low? Just let's see if I can change the settings at all. I'm turning the microphone volume up, so let me know if that's better. I've just knocked over the light. I won't bother picking it up. It makes it a bit more arty, isn't it? All right, so, but let me know in the chat, has that improved things? I can turn it right up to 11 if necessary. So ME/CFS is not laziness. It's not in your head. It's not made up. It's a real condition that has physical effects. Okay, now let's look at really low. This is better. Okay, thank you. I can turn it right up. That's right up to 11 now. If you know that joke, let me know the film that's a reference to. So let's look at medical approaches. Obviously, consult your doctor. Look into side effects and interactions. Consult a pharmacist. Pharmacists tend to know more about the pharmacology of drugs than doctors. That was told to me by a chief pharmacist. Okay, it's really important that, you know, when you chat to your doctor, don't assume that they have looked into these things carefully. You know, I know someone who was put on a sleep medication recently, or sorry, a medication for anxiety, and they had really bad side effects when they had this medication twice. And another doctor said she shouldn't have been put on this medication. And the doctor, when they found out about the side effects, they said, oh, yeah, maybe we shouldn't have put this person on this medication. Okay, so because they were very small, and actually it's a very strong medication, the doctor said actually maybe it was a bit using a sledgehammer to crack a nut. Okay, so why put them on it is the question. All right, so use your judgment. My philosophy about doctors is they are my consultant. I will consult with them. I will ask them, what would you advise? Thank you very much. I'll consider that. I'll do my own research, and I'll I'll look at alternative approaches, okay, which have some evidence base to them, okay. So what are the medical treatments? Just to be clear, at the moment there's no cure yet, or medical cure, but these things make a difference to some people. I do hear practitioners of mind-body approaches dismissing management strategies. What I say is that management strategies can be useful if your nervous system is dysregulated because your body is not working properly. But if we can do things to get your system regulated, then you don't need those management strategies because your body's starting to function properly. So the goal is regulation of the nervous system. And when that happens, people have had profound shifts in their functionality and recovery and progress. Okay, so let's look at medications. So first of all, pain and sleep. Just an important point. In the UK, the National Health Service suggests that sleep medications should only be used in the short term. And one of the side effects of some sleep medications is fatigue. And this is the very thing that people are trying to get rid of. And I've worked with people who've been on sleep meds long term. Okay, so proceed with knowledge. Okay, is my suggestion. Definitely talk to your doctor. In terms of pain, over-the-counter medications like ibuprofen, low-dose prescription options is one way to go. Okay, with painkillers, always got to be careful, especially if they're strong medications, because some painkillers can be addictive. And there's a very interesting program on Netflix called Dope Sick, which is about an opioid, and the pharmaceutical company claims that it wasn't addictive. And according to this program, or this document, it's not a documentary actually. It's a kind of I think it's a 4-part series. It's a story, but it's based on the facts of what happened. Okay, for sleep, improving sleep hygiene is the first approach. Again, I've made videos about that and what helped me because I experienced insomnia. But there are other medications, and often I see that clients are on these: amitriptyline, melatonin may be used. I think Matthew Walker, sleep expert, says that melatonin over the long term can start messing with your natural cycles. Okay. So an issue, Margaret says, so Dinika says, I can hardly hear you. Let me know, everyone else, if that's still an issue. And I'm going to just check my phone is turned off, actually. Yeah, please let me know in the chat, because another person says they're having issues with the volume, which is very strange. Okay, I've got all my dials turned up to maximum. So Dinika's saying she can hardly hear. Let me know if that's still an issue for other people. I can see there's still a number of people on the call, so I haven't lost people because of it. So just let me know. Sorry about that, Dinika. Do check your controls if that's the issue. It might not be. All right, so that's the first thing. All right. When I had sleep issues, I kind of looked into alternatives, and I'm talking about kind of herbal remedies that you can get from your chemist, not products like marijuana. And I do know someone who was taking marijuana, and obviously it's illegal in some countries, routinely, and they ended up in psychiatric hospital because they started having kind of hallucinations, etc. Okay, so that's something to consider. Okay, but I did find the herbal remedies for sleep helpful. And again, talk to your doctor. Okay, look into the side effects, look into the guidance, the best practice. Okay, so drugs for mood and brain fog. Okay, so yeah, as I do, let me know if if you can hear me okay, or whether it's still a bit low in volume. So mood and brain fog, some doctors prescribe antidepressants, ADHD medications, or anti-anxiety drugs, not because ME/CFS is psychological, but to support neurotransmitter function. For orthostatic intolerance, which includes lightheadedness and some people faint when they stand, it can be treated by increasing salts and fluids, compression garments, medications like, I can't read my own writing, fludrocortisone and midocrine. I might be saying that wrong. Okay, experimental treatments, low dose naltrexone, LDN. This can reduce inflammation, is being used more off-label, i.e. not for the purpose it was intended. Some people have found it helpful and a game changer, some people haven't. Okay, the Open Medicine Foundation is doing research into LDN and combining it with another drug to see how it's affecting people with ME/CFS, ME/CFS. So Ampligen is approved in some countries, but it's still experimental in most. Antivirals may help some people, especially if viral reactivation is suspected. And rituximab was studied for a while, but results were mixed, and due to safety concerns, paused. Okay. Health Rising has recently reported on a number of drug developments. One is rapamycin, and studies showed significant symptom improvements in ME/CFS patients, including reductions in post-exertional malaise, improved energy, and reduced brain fog. And that trial is progressing to phase 2. So there's another trial done at the Bateman Home Centre, which found that oxaloacetate led to a 32 to 35% reduction in fatigue amongst ME/CFS patients. Again, more studies are underway. So research suggests that nalmefene, it's also tricky saying these medications, which is an opioid receptor modulator, may be more effective than LDN for people with ME/CFS, fibromyalgia, long COVID symptoms. So again, it's under investigation. And there are other drugs that are being looked at for modulating immune responses, reducing neuroinflammation. There's an antiviral that's showing promise in treating post-viral fatigue and ME/CFS called isoprinosine. So these developments reflect a growing interest in pharmacological interventions for ME/CFS, possibly offering hope for improved symptom management, quality of life. But as I say, always do your research. Look into these things. Look at the side effects. So, all right. So the next thing I want to talk about is mind, body, and nervous system tools. Okay. So for many people, they credit these mind-body approaches with their progress or recovery. Okay. There are more and more recovery stories online now. Raylan Agel, some of you may know, does posts interviews kind of several a week at least, and these are from people who are reporting, dramatic changes. Okay, some full recovery, some works in progress. Okay, whilst ME/CFS is not caused by anxiety or trauma, because not everyone who has anxiety or trauma gets those conditions, the nervous system is often dysregulated. Actually, the cause of these conditions, some doctors think, is multifactorial. It's a combination of things that resulted in developing the condition. For me, it was 3 years of sustained stress on top of some kind of personality traits. I had a stressful job, and I was already a worrier. I burned the candle at both ends, was a bit of a hedonist, and all of those things in combination just finished me off. Okay, so the nervous system is dysregulated, and therefore exploring tools that are helping to regulate the nervous system are important, because when the nervous system is regulated, the body shifts into the parasympathetic rest and digest healing state. That's where healing happens. And for example, when we're in that state more consistently, our sleep improves. Okay, my sleep improved. One of the factors that really improved my sleep is I got to the point where I was so exhausted that I stopped worrying about sleep. I started to sleep. But as I started to get better, my sleep in general improved. And I noticed when I have had periods of stress, it affects my sleep. I tend to wake up, more early, for example. I'm not sure if that's what's going on now, but anyway. So the first thing is mindfulness and meditation. So mindfulness-based stress reduction, MBSR, has shown benefits in fatigue, sleep, and emotional resilience. So even a few minutes a day of breath awareness, guided meditation, body scans can begin to calm the system. When I do the resilience group coaching, which happens twice a month, no charge, you are welcome to make a donation. We start with doing a very simple checking in process. And people often say that they feel more relaxed from doing that, even if we do it for just a few minutes. Okay, so the second thing is vagus nerve stimulation. So again, I made a video about the vagus nerve. The vagus nerve is key to your rest and digest state, and you can tone it using various techniques: humming, gargling, cold face immersion, if not whole body immersion. I tend to, if I'm having a shower in the morning, I tend to turn the water to cold, and it does kind of make you change your breathing. You have to start breathing in a very focused way to just kind of regulate your system. But I remember one time when I swam in the North Sea, and when I had ME/CFS, I couldn't. At one point, I stopped swimming because it was too stimulating and too draining. But I got back to the point where I could swim again. And a couple of years ago, I went swimming in the North Sea, which is very cold, and I was wide awake for the rest of the day. I was so alert. It really felt like it really woke my system up in a good way. Okay, so, and even singing, okay, can help regulate your nervous system. That's why kind of people report benefits to singing in the choir. Okay, third thing is trauma sensitive somatic practices. Apparently Feldenkrais method, which I'm not that familiar with, TRE, tension trauma release exercises, or gentle somatic yoga can support the nervous system. I started doing yoga when I was about 15, 16 because I was quite anxious about my exams, and that was a lot of anxiety for nothing because I did fine. But that's when I had the anxiety medication, didn't work, so I started doing yoga, and I carried on doing yoga when I could, when I had ME/CFS. All right, and it is a good regulating practice. Fourth strategy is, as I mentioned earlier, energy management. This is a stop-gap measure, but it is huge. If your system is dysregulated, then if you're not listening to your body, then that's going to cause problems. So learning to listen to your body and respecting your body can make a difference. Some people use tools like heart rate monitoring, journaling, your crash triggers, scheduling rest breaks to prevent post-exertional crashes. So that can be helpful for some people, in terms of using the tech, watches, Garmin watches, etc. Some people have said they find it helpful. Some people find that they were checking too often, getting a bit obsessive about it, and that was actually stressing them out. All right. So use your judgment. So these things aren't necessarily quick fixes, but they are powerful ways to support your body when practiced with self-compassion. So let's just talk about the controversial treatments. Okay, so 2 treatments in particular that come up are cognitive behavioral therapy and graded exercise therapy. These were once widely recommended, but many patients reported significant harm, particularly with graded exercise therapy. And when I had cognitive behavioral therapy, I went to King's College Hospital, which is where Professor Simon Wesley was in charge. They talked about graded exercise therapy, but I ignored the advice, because the advice was keep doing the same level of activity no matter what. And actually, I know there were days when I had experienced stress that, for instance, at one point I was doing 15 minutes of walking every day and yoga, etc. And I didn't have the energy to do 15 minutes. I know if I had done that, it would have just pushed me deeper into a hole. So I listened to my body. I said, right, today's not a 15-minute day. It might be a 1-minute day or a 5-minute day. I'm going to listen to that. And when I feel ready, I'm going to go back to that amount. And sometimes within a couple of days, I was ready to go back to 15 minutes and was able to increase that. So one of the issues is that graded exercise therapy encouraged people to push beyond their limits, and that triggered crashes. So the UK has an organisation called the National Institute for Clinical Excellence, NICE for short, and their guidelines have removed graded exercise therapy and softened their stance on cognitive behavioural therapy, CBT. So CBT is now considered a supportive tool, not a curative treatment. The key point is this: you have to be really mindful about whether pushing through fatigue is a sensible strategy for you. And I say it in that way because, a lot of people recognize pushing through is not good. Occasionally someone says, oh, I kind of had fatigue, but not so much they pushed through, but they actually managed to break out of the state of stress. They got into a regulated state and they made a breakthrough. Now, I'm not advocating that as a strategy because you have to use your judgment, okay? Just pointing out that when people get into a regulated state, that can make a massive difference. And I've talked before about the first client I worked with who came in a wheelchair. And on the second day, she walked into the clinic and she didn't use her wheelchair again. Now, I was blown away by that. She was blown away by that. But that's what happened. And what happened is she went from being in a very stressed state, recognizing, oh, wow, I'm generating a lot of stress here. Some of it's subconscious. And once she realized that, she was able to get into a regulated state. And she felt better the next day. Okay. Now, that's not everyone's experience. I worked with probably about 15, 16 people in a wheelchair. And all of them except for two people. One person came because she had cancer and sadly she died. The other person sadly committed suicide. And obviously, if anyone's watching this video and they are feeling suicidal, please get help. All right. But all the other people stopped using their wheelchair. Some quickly, some took longer. Okay. One client who was using a wheelchair, a month later, she was in the gym doing gentle weights, and she was working with a physio who had experience of dealing with people with ME/CFS. And this physio actually sent me lots of clients. She's from Norway. So, fifth thing I want to talk about is nutrition complementary approaches. Supplements like CoQ10, magnesium, L-carnitine, B vitamins are commonly tried. Research is mixed. I know that Dr. Sarah Myhill, who's a doctor who's worked with people with ME/CFS, I think she's retired now, but if you check out her book, she talks about some of these things and when to take them. Okay, for some people, anti-inflammatory diets, gluten-free or low histamine diets can reduce system flares, as I say, for some people. All right. I think a general principle about nutrition is the more natural the food we eat, the less processed it is, the less sugar. Sugar generates inflammation. So the more we have a healthy diet, and of course, we don't want to be obsessive about it. I will still go and have a burger and chips when I'm in a pub, but in general, my diet is pretty clean, okay? And, so it's always important. Don't be obsessive about it, but think about what is a balanced approach, okay? I still have a weakness for chocolate. It is dark chocolate, so I think that's, hasn't got as much sugar in it as some of the other stuff, which is it's very addictive. So let's wrap up. Do let me know what your takeaway is from this conversation. Do leave a comment in the chat. Still haven't heard any more comments about whether, unless I've missed them. Oh yeah, sorry. Is this pacing? Are you saying it should be temporary? Well, first of all, we have to define what we mean by pacing, because one definition is that you kind of do this much every day in a strict way, in a very formulated way. And, what I was saying earlier is that we need to be responsive, to listen to our body, because our body, our emotional brain communicates via emotions, symptoms, and sensations. And so I had a client who at one point, she kind of was finding going into shopping malls, kind of a bit overwhelming. And so if she was doing a kind of pacing thing, she would be kind of saying, right, okay, I'll just walk for a certain amount of minutes, etc. And what she realized is that she was kind of, when I asked her, what do you think you're feeling? She said, yeah, I'm feeling anxious. What do you think you're saying to yourself, maybe subconsciously? And she said, oh, actually, I think I'm saying to myself, this is dangerous. Okay. And so what she decided to do is that she would go to a shopping mall, and rather than sticking to a kind of strict regime of I'm going to walk this many minutes, anytime she felt her body tense up, she'd just sit. She would do some of her relaxation strategies, and she would tune into her body, and she would say, right, okay, do I want to carry on, or do I want to just go back home now? Initially, sometimes she was going back home, and the more she did this, the more she was like, okay, no, actually, I feel I can do more. And she'd, again, if she noticed sensation, symptoms, she'd pause, she'd sit down, she'd just tune in. What's going on emotionally? What am I saying to myself? What do I need right now? And this helped her. And so that wasn't a strict pacing approach, because pacing might be saying, do it for this amount of time every day. Stick to that, okay? We want to be more flexible. Do watch the video where I talk about pacing and whether it's helpful in my YouTube channel, okay? Hopefully that'll make more sense to you, but let me know if that's answered your question, Margaret, if that's helpful. Have you worked with old people? Yeah, you'd have to define old. Some people say I'm old, but yeah, I've worked with people in their 70s, early 80s, and like I remember one woman who actually doesn't live very far away from me. She had fatigue-related issues from a young age, and she was in her 70s. And she sent me a long letter of all the shifts she'd made. I think a week after the training, she sent me like 4 pages of A4 handwritten of all the things she'd done. Okay, so I've worked with a number of people who are old. So I'm 80, 6 years into me. Yeah, so sorry to hear that, Dinaka. I'm wondering if you're from the Netherlands with that name, but I might be wrong. So yeah, I have. If you kind of want to have a chat, I'm really happy to have a free, no obligation chat. We can explore that a bit further. When I have a chat with people, I explore what's going on, and that helps me identify whether the issues someone is dealing with are things I can help with. Okay, and if I feel like, oh, I don't feel I can help you, I would say, all right, I'd try and point you in the right direction. So if you've got any other questions, let me know in the chat. So there's no perfect roadmap for chronic fatigue syndrome, ME/CFS. It does require a lot of patience, acceptance of where you are right now rather than acceptance of the condition as being a permanent thing, compassion, trust, flexibility. So if you're navigating this condition, no, you're not alone. You're not imagining it. You're allowed to listen to your body and do what you need. And if that is resting when needed without guilt and allowing yourself to rest deeply, because some people don't, then do that. It's important to tune into your body and discern what you need, because sometimes it might be rest, it might be a siesta. Sometimes it might be something else. Okay? For example, if you're bored, you might want some connection, fun, stimulation, CFS. All right? In the right amount. Okay? Remember, your body is doing its best to protect you. Sometimes the signals that your body's sending is because of some stuff we're saying to ourselves, perhaps subconsciously. I remember one time when I decided to train as a hypnotherapist and coach, I started panicking. I was generating massive amount of stress and my whole body would get locked up in tension. And I kept having to practice these techniques and repeat my little mantras to myself. I trusted my body's incredible, mind and body's incredible healing power. I trusted my ability to make decisions that support me. And I did manage to get myself into a relaxed state by the time I started the course. And it was one of the best things I'd done, because it was a great learning experience. The trainer was a brilliant trainer, learned so much and made friends, a few of whom I'm still in touch with. This was back in 2005 I started that training. So, as I say, let me know what your takeaway is from this. What's resonated? If you do like the video, do leave a comment, do share it with someone who might need it. I'm also interested to know if you've tried any of those treatments, whether they're medications or something else. So if you've got any questions, a topic that you'd like me to cover in a future live session, let me know. If you want to dive deeper into mind-body approaches, you can check out my playlist. I've created a playlist called Exploring Recovery, where there's a series of videos kind of in an order, and I share one of the videos. The second video, I share a technique that I found super powerful and helpful. Okay, and that video has got good response. If you want help now, you're welcome to join my Facebook group. I share content every day. You're welcome to join the Resilience Group Coaching, which happens twice a month. There's no charge for that. You're welcome to make a donation if you like, but don't have any expectation. That's my little way of giving something back. All right. If you'd like to join that, it's a friendly place. We just had a call yesterday, and some of the things that people were sharing, one of the things I say in that group, there's no one in that group who is as smart as all of us. So share your wisdom. And people, share brilliant things. And you're able to watch the replays in the Facebook group if you can't make it. If you want to go faster and want to explore working together, I am going to be starting a new Building Resilience course soon. If you like details of that, comment the word course below. And if you'd like to explore working one-to-one, comment chat below and we can have a chat. No obligation, as I say. So thanks for being here. Thanks for your input. Keep doing the things that you know to be helpful. Habit forming. We can start small, still powerful. All right. Dare to dream big dreams. Keep going. You've got this. Wishing you great health. See you in the next video. Thanks for watching. Bye for now. I will send you, what I will do, Margaret, is I will put the link below this video. Sometimes I can't see these comments on YouTube for some reason. I've tried to figure out how to fix that. So what I'll do is I'll put the link for the Building Resilience course below the video. So click on that link. And if you're interested, you don't need to pay anything right now. Just send me a message saying interested. All right. So thanks, everybody. I've gone on long enough. So I'm going to pause there. And Dinka says, are there brain training, retraining courses you have good experience with? Yeah, well, one of the things I retrained in is an approach called the MindBody Reconnect. And I did the lightning process years ago and really learned stuff from that. Okay. And then I did the MindBody Reconnect course training because I was very interested in that approach, and I found it super helpful. And that's not a kind of pitch. There are other practitioners you can work with if you want, but I would definitely check that out. So if you want to know more about the MindBody Reconnect, put the words, I'm giving myself lots of work here, mind below, and I will again add the link to the YouTube video. I can't add links to Facebook, otherwise it buries the video. So, but you can always put the word mind and I will send you a private message. All right, so hope that gives you food for thought. Thanks for your questions, your participation. Hopefully it seems like we got the sound sorted out. But keep going, wishing you great health. Thanks everybody, bye for now.